Hi, my name is Wesley Hoyland, and I'm going to be talking about the three things I think everybody should know about HIV and AIDS. So, the three things are: what is HIV and AIDS? I'll describe them for you. How does it transmit from person to person, and how can it be prevented? And thirdly, if the treatment options for HIV positive people. HIV stands for the Human Immunodeficiency Virus, or HIV as we all call it. It is a retrovirus that causes the HIV infection and attacks and destroys the infection-fighting CD4 cells, or commonly known as T cells, of our immune system. The loss of these CD4 cells makes it difficult for our body to fight infections and certain cancers. Without treatment, HIV can gradually destroy the immune system, leaving the body more vulnerable to opportunistic infections, and that can eventually lead to the extreme stage of HIV called AIDS, or the Acquired Immune Deficiency Syndrome. HIV is spread from an HIV positive person to an HIV negative person through unprotected contact with blood, semen, pre-ejaculate fluid, rectal fluid, vaginal fluid, vaginal fluid, or breast milk to certain openings in the body. These openings include open wounds, the penis, the anus, and the vagina. So pretty much, HIV is transmitted from blood-to-blood contact, such as sharing needles, through unprotected sexual activity between a HIV positive person and an HIV negative person, and from mother to child through pregnancy or through the mother's breast milk. For example, the mother could be breastfeeding her teething child, and as the child teethes, they have open wounds in their mouth. So as the baby intakes the breast milk, it causes a high risk for them to attract the HIV infection in themselves as well. So in the United States, HIV is most commonly spread by having anal or vaginal sex. However, people that are HIV positive can still have a normal sex life with the use of condom protection. It provides a barrier between the fluids. A common prevention acronym that we like to use is called ABC. A stands for abstinence, and this is the only 100% way to avoid contracting HIV, and abstinence is pretty much just withdrawing yourself from all sexual activity and just avoiding it altogether, which some people definitely can do, but for the other people who can't, the B and C apply as well. So B is be faithful. That means being honest and straightforward with your partner, with any sexual partner you have. That means getting tested and knowing if you have the disease or not, and if your partner has the disease or not, and just being real honest with them. Lastly, C is for condoms. Not only do condoms prevent unwanted pregnancies and transmission of other STDs from one partner to the next, but it also protects from transmitting HIV as well. And this is again by not letting the fluids come in contact with any openings. As of today, there is no current cure for HIV. However, people living with HIV can live a full, healthy life as long as they follow a treatment plan. The most current treatment plan is called ART, or the antiretroviral therapy, and people on ART take a combination of HIV medicines called the HIV regimen every day. It is very important that they take it every day, because if you skip a couple of days, or like take it every other day, you're real sporadic about it, then the HIV will become resistant to this HIV regimen of drugs, and then it won't work as well, and you're at a high risk of contracting AIDS. But the ART pretty much works by preventing the HIV from multiplying and reduces the amount of the virus in your body. So having less of the HIV in your body protects your immune system, because the HIV doesn't attack it as much, and it prevents the HIV infection from progressing into AIDS. Although ART can't cure HIV infection, it is a really good substitute for people that are HIV positive to live longer and healthier lives. Being HIV positive today isn't a death sentence like it used to be, and with treatment, HIV is now a manageable and long-term condition that you can control. This means AIDS is no longer a reality for the large majority of people living with HIV, and they can have normal lives. Thank you.